Hi, my name is Amy and this is my 266 video for IV fluid and medications. So to start off with, I'm just going to go through the supplies we'll be needing. So 250 mLs of the 0.9% sodium chloride or distilled water bag. Also the 100 ml 0.9 sodium chloride or distilled water bag. The tubing we're going to be using is the IV gravity set with the Y-Site. Also, for the piggyback, we're going to be using the secondary set. And then we'll also have hand hygiene, gloves, alcohol preps, 250 milligrams of amoxicillin, and medication labels. So we'll check the provider's orders, go to the patient's room, close the patient's door, and verify the patient and explain the procedure that we're going to be doing. Then perform our hand hygiene and put on our gloves. To start off with, we're going to be doing 150 mLs of fluid. So we're going to open this fluid bag here. And this is the 250 of fluid. And we're just not drop that and hang it on your IV pool. Like so. And then we'll go ahead and take our IV gravity set. And I'll just explain this here real fast. So we'll unravel it, make sure nothing's kinked on the tubing. This is the spike, so this goes into the bag. This is the drip chamber, so we'll fill this up halfway to 1/3 full. This is a roller clamp, so we'll just make sure it's off position for now. And this will kind of adjust our drops and speed that we deliver. And then this is our Y set, so you can kind of see it looks like a Y, and our port for our piggyback. And this goes into the patient's IV, so we want to make sure this stays sterile. To start off with, I'm going to go ahead and take off the cap and poke it into the bag. And it should be off. And we'll fill up the drip chamber, about 1/2, 1/3. And I'm making sure my tips stay sterile. Okay, and then we'll do our math. So we have 150 mLs per hour. So we're gonna go ahead and divide the 150 by 60 to get 2.5 mLs per minute. And then times it by 15, because 15 drops. And you can tell that by your tubing, because it's a 15 drop tubing right there, so you always want to check that on your tubing. And that would get us around 37.5, and we'll go ahead and round that up to 38 drops per minute. So roughly 19 drops in 30 seconds. So I'm going to start off with making sure you can see it and opening our tubing just to start some drops. Seems a little fast. Okay, now we can go ahead and start my timer. And I'm going to start off with doing just 30 seconds. So it's still like a little bit fast. Let me take it down just a notch. Okay, and then from here I'm going to count to full minute. Okay, and that's about 38 per minute. And we'll go ahead and clean the port and on the catheter and attach the end to it. And then prior to giving the medications, we'll just verify the 6 rights: right patient, right documentation, right dose, right medication, right route, and right timing. So make sure you have all those rights. Also make sure the patient's not allergic and just confirm he's not or she's not allergic to amoxicillin because it's a common allergy. And then we'll take the 100 ml 0.9% sodium chloride bag and put in 250 milligrams of amoxicillin. Some have ways that you can kind of attach it here and dilute it, or we would have to dilute this and then draw it into it, which I kind of played around with. But for this video, I'm just going to explain it. So we'll go ahead and attach this above. We want to make sure we attach it above the fluids, the piggyback here. So I'm just going to put it right there. And we'll grab the secondary Y set, which looks pretty close to the gravity set. It just doesn't have the Y at the end. It just has the port that you can kind of attach. Okay. And we'll, same thing, this is the spike end, so you're going to go ahead and insert the spike end right here. Oops, we have to open the bag, I guess. And insert into the bag, and make sure your roller's off too, so it's not going to drip on you, or your clamp roller's off, which I have already. And we want to make sure we keep that sterile. And here we're going to go ahead and do the math. So we want 100 mLs over 15 minutes for the amoxicillin. So 100 divided by 15 minutes would be 6.66667 roughly, and then times it by 15 drops, which that's from our tubing, which you can see again right here. And so times that by 15 drops, and we get 100 drops per minute, which is roughly 16 drops per second, so pretty fast. So when we open this up, I want to make sure I get all the air bubbles out again. Perfect. And you can tell it's kind of kink right there. Okay. And it's pretty fast. And we'll make sure to clean the Y site adapter end so we can adapt the piggyback on and make sure it keeps sterile. So that is all set up, and then we'll count out 16 drops per 10 seconds. And it's a little fast, so I'm going to slow it down just a hair, and I do want to kind of fill up my chamber just a little bit more too. Okay. And that looks good for the 10 seconds. So we could also count 100 per minute if we wanted to, which I'm gonna just do just in case. Perfect. Okay, we can stop that. From here, the patient should be all set up. Check their IV site, make sure it looks fine, that it's fusing pretty well. And then go ahead and remove your gloves, wash your hands, do your documentation, and continue to monitor and check how the patient's doing over time. Awesome. Thank you so much.